North Carolina has a robust array of prevention services, so it's important to recognize that in North Carolina we are funding as a state and in making investments in all three levels of prevention. As it relates to secondary prevention, which is the more targeted prevention service, we have, in terms of support in North Carolina, what we term state-level infrastructure. And when we talk about supporting evidence-based secondary prevention programs in North Carolina, what we're talking about is the public-private partnerships that are convened in order to invest the state-level supports needed to help support local communities in implementing evidence-based programs with fidelity. So what that means is that you have public funders, you have private foundations, you have community partners who are coming together to convene discussions and decisions around what are the shared outcomes that are needed for improving the outcomes for children and families, specifically those that are engaged or preventing those families from becoming involved in the child welfare system. And how can we leverage our shared resources and our limited resources in such a way to be able to provide the supports needed for local programs to implement an evidence-based program with fidelity. So those programs in North Carolina currently include the Incredible Years parenting series, and those two programs are parent skills training programs that are targeting parents with children ages 3 to 6 or 6 to 12, really looking to help increase and promote the protective factors in families' lives, and also help to ensure the social emotional competence of children so that they are better equipped to deal with the stressors that they may be facing, and they can make better choices. And so with respect to the Incredible Years is one program. The other program that we also have some state-level infrastructure around includes the Strengthening Families program for parents with children ages 6 to 11. And we also have the Circle of Parents program, which is a self-help, parent-led mutual support group type program for parents to come together to engage in conversation and social support, networking, to help reduce the stresses that they may be facing in their day-to-day parenting or in their day-to-day lives. Those particular programs were selected back in the 2005-2006 fiscal year. So the North Carolina Institute of Medicine convened a task force that took a look at what the child maltreatment service array was in North Carolina, created 37 recommendations for structuring a statewide response to child maltreatment prevention for the state of North Carolina. And through those recommendations, one was to convene what was called the Alliance for Evidence-Based Family Strengthening Programs, which was a convening of the public-private funders and those who had significant vested interest in implementing these programs. We took a look at the landscape in North Carolina at the time. We found that these three programs in particular were the ones that were currently being implemented and for which we had the most promise to make additional investments in. And through that work, we actually worked with the Prevent Child Abuse North Carolina chapter here to begin structuring a coaching model and an implementation model wherein Prevent Child Abuse staff could go into the programs that were funded at the local level implementing one of these three programs and to assess their needs, to assess the supports that they need to implement those programs more fidelitous to the model.